Nursing interventions and rationales for falls management. The following are the therapeutic nursing interventions for risk for falls. Nursing interventions for adults or patients in the hospital or long-term care setting. Design an individualized plan of care for preventing falls. Provide a plan of care that is individualized to the patient's unique needs. Planning an individualized fall prevention program is essential for nursing care in any healthcare environment and needs a multifaceted approach. Avoid relying too much on universal fall precautions as different individuals have different needs. Universal fall precautions are established for all patients to reduce their risk of falling. These standard strategies, in general, help develop a safe environment that reduces accidental falls and delineates core preventive measures for all patients. Provide signs or secure wristband identification for patients at risk for falls to remind healthcare providers to implement fall precaution behaviors. Signs are vital for patients at risk for falls. Healthcare providers need to acknowledge who has the condition, for they are responsible for implementing actions to promote patient safety and prevent falls. Details should be printed/written in black against a white background. Only red color should be used to signal special patient status. These recommendations are consistent with current developments in patient identification, Subdalis et al., 2009. Transfer the patient to a room near the nurse's station. Determining which patients are most likely to fall is essential to prepare and anticipate the nearby locations and provide more constant observation and quick response to call needs. Place items the patient uses within easy reach, such as call light, urinal, water, and telephone. Items that are too far may require the patient to reach out or ambulate unnecessarily and can potentially be a hazard or contribute to falls. Respond to call light as soon as possible. Helps prevent the patient from going out of bed without any assistance. Additional effort is required to reach the ideal or even a reasonable level of patient safety first practice in current hospital environments. Avoid the use of physical restraints to reduce falls. Studies demonstrate that regular use of restraints does not reduce the incidence of falls. The use of a trunk restraint is associated with a higher risk for falls and fractures among patients with either Alzheimer's disease or dementia, Luo et al., 2011. Inform the patient of the advantage of wearing eyeglasses and hearing aids. Encourage to have vision and hearing checked regularly. Hazard can be reduced if the patient uses appropriate aids to promote visual and auditory orientation to the environment. Visual impairment can greatly cause falls. Provide high-risk patients with a hip pad. Hip pads, when worn properly, may reduce a hip fracture when a fall happens. Place beds at the lowest possible position. Set the patient's sleeping surface as near the floor as possible if needed. Keeping the beds closer to the floor reduces the risk of falls and serious injury. Placing the mattress on the floor significantly reduces fall risk in some healthcare settings. Low beds are designed to lessen the distance a patient falls after moving out of bed. Although these beds don't prevent a fall, they reduce the distance of a fall, reducing trauma and injury, Quigley et al., 2015. For tall patients, avoid keeping the bed in a low position at all times. Patients who are tall and with weak leg muscles who try to sit on the bed from a standing position are likely to fall onto the bed because it's too low for them to lower themselves safely. Also, if a tall patient attempts to get up from a low bed without assistance, the patient is likely to fall back down onto the bed or miss the bed and fall onto the floor. 11. Secure bed and chair alarms when the patient gets up without support or assistance. Bed alarms serve as early warning systems to warn nursing staff that a patient is about to get up from bed without assistance. They're designed to promote timely rescue, not to prevent falls from bed. Audible alarms can also remind the patient not to get up alone. The use of alarms can also be a substitute for physical restraints. Aside from bed alarms, increased supervision for high-risk patients also may help prevent falls. Raise side rails on beds, as needed. For beds with split side rails, leave at least one of the rails at the foot of the bed down. According to research, a disoriented or confused patient is less likely to fall when one of the four rails is left down. Place a non-skid floor mat at the bedside. Floor mats can serve as a cushion that helps reduce the impact of a possible fall. Encourage the patient to don shoes or slippers with non-skid soles when walking. As a person ages, gait becomes slower, and stride becomes shorter. Footwear influences balance and the subsequent risk of slips, trips, and falls by altering somatosensory feedback to the foot and ankle and modifying frictional conditions at the shoe/floor interface. Non-skid footwear provides sure footing for the patient with diminished foot and toes lift when walking. Shoes with low heels and a large contact area may aid older adults to lessen the risk of a fall in everyday activities and settings. Tensor et al., 2004. For patients with shuffling gait or foot drop, avoid using non-skid socks. Patients with a shuffling gait increase fall chances dramatically. To reduce fall risk, shoes should be with a little to no heel, thin soles with slip-resistant tread and support the ankles. Have the patient wear proper footwear. Advise patient to use non-skid socks to prevent the feet from sliding upon standing. However, encourage patients to wear appropriate, well-fitting shoes, not non-skid socks for ambulation. Improve home support. Many community service organizations provide financial assistance to make older adults make safe environments in their homes. Familiarize the patient with the layout of the room. Discourage rearranging the furniture in the room. A fall is more likely to be experienced by an individual if the surrounding is not familiar, such as furniture and equipment placement in a certain area. The patient must get used to the room's layout to avoid tripping over furniture or any large objects. Teach patients how to safely ambulate at home, including using safety measures such as handrails in the bathroom. Helps relieve anxiety at home and eventually decreases the risk of falls during ambulation in their home setting. Raised toilet seats can facilitate safe transfer on and off the toilet. Use heavy furniture that will not tip over when used as support when ambulating. Make the primary path clear and as straight as possible. Avoid clutter on the floor surface. Patients having difficulty balancing are not skilled at walking around certain objects that obstruct a straight path. Recognizing and fixing potential hazards and establishing assistive devices are effective fall prevention approaches that make the home environment safer for older adults. Provide the patient with a chair with a firm seat and arms on both sides. Consider locked wheels as appropriate. Chairs with firm seats and armrests are easier to get out of, especially for patients who experience weakness and impaired balance. 22. Provide appropriate room lighting, especially at night. Patients, especially older adults, have reduced visual capacity. Lighting an unfamiliar environment helps increase visibility if the patient must get up at night. Improvement in lighting at home may reduce fall rates in older adults. Provide the patient with assistive devices for transfer and ambulation. The use of gait belts by all healthcare providers can promote safety when assisting patients with transfers from bed to chair. Assistive aids such as canes, walkers, and wheelchairs can improve patient stability and balance when ambulating. Consider physical and occupational therapy sessions to assist with gait techniques. Occupational therapy is defined as the therapeutic application of activities of daily living (ADL) occupation in an individual or group to develop and enhance participation in roles, habits, and routines at home, at school, in the workplace, in the community, and in other settings. These interventions enable individuals to integrate exercise into their day-to-day routine. Group exercises can be incredibly helpful for seniors. Observing their peers when performing the exercises can attain progress in their reactions and behavior. Summerjeet et al., 2020. Acknowledge that when the patient attends to another task while walking, such as holding a cup of water, clothing, or supplies, they are more likely to fall. Patients should avoid carrying different objects that could cause a higher risk for subsequent falls. Limit use of wheelchairs as much as possible because they can serve as a restraint device. Most people in wheelchairs do not move. Wheelchairs, unfortunately, serve as a restraint device. If the patient has a new onset of confusion, delirium, provide reality orientation when interacting. Have family bring in familiar items, clocks, and watches from home to maintain orientation. Reality orientation can help prevent or decrease the confusion that increases the risk of falling for patients with delirium. Ask the family to stay with the patient. Helps prevent the patient from accidentally falling or pulling out tubes. 29. Consider using sitters for patients with impaired ability to follow directions. Sitters are effective for guaranteeing a secure, protected, and safe environment. Patients with musculoskeletal problems such as osteoporosis are at increased risk for serious injury from falls. Musculoskeletal pain, explicitly general pain, is a fundamental risk factor for falls in older women with disabilities. The risk for recurrent falls and self-reported fractures due to falls was also heightened in women with musculoskeletal pain, almost invariably in women with general pain, Levea et al., 2002. Bone mineral density testing will help identify the risk for fractures from falls. Physical therapy evaluation can identify problems with balance and gait that can increase a person's fall risk. Collaborate with other healthcare team members to assess and evaluate patients' medications that contribute to falling. Examine peak effects for prescribed medications that affect the level of consciousness. A review of the patient's medications by the prescribing healthcare provider and the pharmacist can identify side effects and drug interactions that increase the patient's fall risk. The more medications a patient takes, the greater the risk for side effects and interactions such as dizziness, orthostatic hypotension, drowsiness, and incontinence. Polypharmacy in older adults is a significant risk factor for falls. Fall risk increasing drugs, FRID, refers to the medications well reported to be associated with heightened fall risk. These comprise but are not limited to antihypertensives, antipsychotics, narcotics, sedatives, and anticholinergics. For example, recent studies have revealed that long-term use of proton pump inhibitors, PPIs, increase the risk of falls, Lapumne et al., 2019. Allow the patient to participate in a program of regular exercise and gait training. Studies recommend exercises to strengthen the muscles, improve balance, and increase bone density. Increased physical conditioning reduces the risk for falls and limits injury that is sustained when fall transpires. Land and water-based exercise programs may be similarly beneficial on balance and gait and thereby reduce the risk for falls. Water exercise may contribute a positive benefit on balance and gait for women 65 years and older. Water-based exercise could be regarded as an alternate exercise activity for seniors, significantly if land-based exercise is challenging due to chronic musculoskeletal conditions. Booth, 2004. Encourage patient to do chair rise exercise or sit to stand exercise. Chair rise exercise is a simple sit to stand exercise that helps strengthen the muscles in the thighs and buttocks and improves mobility and independence. The goal is to do chair rise exercises without using hands as the client becomes stronger. See Resources section for a detailed instruction on how to perform chair rise exercise. Explain the use of vitamin D supplements. Vitamin D helps in maintaining postural balance, propulsion, and improves executive functions and navigation abilities among older adults. Vitamin D supplementation determines gait performance and prevents the occurrence of falls and their complications among older adults. N. Weiler et al., 2010. The prescription of at least 800 IU of vitamin D daily is insufficient elderly patients is a simple intervention that should be integrated into new methods for postural rehabilitation, primary and secondary fall prevention, strength training, integration of body schema, automation of gait, and adaptation to the environment.